Good morning. Again, I should give you a trigger warning. I'm still in my jammies here, and thank God I am thousands of miles away from the Chester police, so they don't drag me out in the middle of in the wee hours of the morning in my pajamas as they did to Lucy. Anyhow, I've been up. As you can tell, the sun isn't even up yet. I have been up for quite some time, as usual. As always, my day has always started way too early, uh, due fully in part to the Empress nuisance and her demands for being fed very early and dragging me out of bed. I just wanted to give you information. I received the most wonderful email from a gentleman who has seen some of my stuff that I have posted, and just wanted to give me some his input. He's an incredible microbiologist, and I thought I'd read part of his email that it sent to me, mostly because, like Lucy, I like to self-datix, and if there's anything that might be, that differ from what I had said, again, I always want to post the most up-to-date and most realistic and concise and information I have. And, I am just a nurse, although that's just a nurse is not something. It is, I meant to say that I don't have the microbiology background that this gentleman has. I have a wealth of information just from my nursing experience, and just a nurse should not ever be taken seriously or as a thing to fellow nurses. It's just meant to say that I don't have their wealth of experience, as they don't have the wealth of experience I have as a nursing. Um, Here goes. Just points that we agree on. Infection having been a likely major factor in many of these deaths, the majority, all 14 indicted babies in one analysis I found, were on antibiotics, implying that infection was suspected, even though there is scant microbiological data. The absence of microbiology, infection control, infectious disease intervention, and investigation being curious, to say the least. Yes. You are right to say that the main lab is at Arrow Park, with only an emergency out-of-hours lab at the Countess of Chester itself. This is the hub and spokes model, increasingly adopted in the UK on the grounds of cost efficiency and better standardization, quality lab control, than if you have a small lab at each hospital. A downside to this is that it is difficult to recruit good microbiologists to serve hospitals that no longer have a lab, although they still need someone for antibiotic and infection control advice. Another downside is that sample processing is delayed while samples are transported from peripheral sites to the central hub. As I am sure you know, UK and US microbiology infection systems differ. In the UK, microbiologist is generally a lab-based medic who gives clinical advice and joins ICU ward rounds, or should do so. In the US, the micro is often a wholly lab-based non-medic, a technician, although very, very well educated, along with a vastly larger cadre of infectious disease physicians who are very directly involved in patient care. Correct. We have basically, if some bug was cultured out and the lab results came back, the primary care physician, whoever that might be, the pediatrician or GP or internal medicine physician, would then contact an infectious disease doctor, who would then take it from there. It probably would obviously speak to them at first on the phone and to start whatever interventions are necessary so far as the antibiotics, and the infectious disease doctor would take it from there. And they are phenomenal, absolutely phenomenal. We'll go back to the email. The unit being microbiologically contaminated, sewage leaks and pseudomonas in the taps, and having a layout that was not conducive to good infection control. The Countess of Chester has a litany of bad reports regarding infectious rates. A couple of points of difference. I know scant evidence of C. difficile being a pathogen in neonates. Sometimes I do mention this. I am an adult, a nurse. My experience was as a chart auditor, was in neonatal intensive care units, but I just do mention it as that it is in the hospitals. It invades the guts of elderly folks who've been on multiple antibiotics, but children can carry it harmlessly. I did not know that. Secondly, while cefotaxime, which I also called Suftin, can be used in meningitis, I don't consider its use to be a smoking gun, which I thought it was, so I absolutely stand corrected. It has other uses, and mostly here would prefer using something called ceftriaxone in meningitis, which I don't believe I saw, and if I do see, I will let you know. I think it's more likely the cefotaxime or the Sefton that I had mentioned, the meningitis medicine, was deployed owing to fear that their standard penicillin gentamicin regime was underpowered or failing. So that even bothers me more. The fact that they weren't even considering meningitis, which is a very, very common and a known issue in neonates potential. And the it's owing to the fact that, again, with neonates, everything is, shall we say, not formed correctly. And there is something called the blood-brain barrier. And the blood-brain barrier, there's a barrier between the blood and the brain. There's some mostly, and what it is it's a protective measure. You just don't want poisons and germs and everything to get to the most important organ in your body, which is the brain. So it is underdeveloped, so they literally cannot filter pathogens as well as someone who is, an adult or a child. Again, even children are very susceptible, much more susceptible to meningitis than adults. So you can imagine premature babies, which I think all but baby D were things. So again, this just even bothers me more. I agree, based on your summary, that some babies were receiving rather unusual anti-infectives. Specifically, I agree with that ticoplanin, I hope I pronounced it correctly, would mostly be used for serious methicillin-resistant staph or MRSA infections. These are unusual in neonates, regardless of the Countess of Chester having poor record for MRSA in general. Most are in the elderly, but use of the antifungal amphotericin without any specific diagnosis of a fungal infection is remarkable. I will discuss this baby later. This was a non-indicted baby. This is a baby that mom and baby came in severely infected. And the fact that they threw amphotericin at this is just, like he says, it's just incredible, because he says this drug is not used empirically, meaning sometimes when you think someone's infected, you literally would probably start there's just certain antibiotics you start after you collect all the cultures that you're able to, especially that blood culture. And you start them on certain antibiotics in the hope, they're usually broad spectrum, and then in the hope of getting that, and in that way, and until you can get the cultures back, which could take a couple of days. And he says that there is still scant data about what organisms, if any, were cultured. Again, I was just amazed. Although blood cultures are very difficult to get positive in these babies, because basically it's because there's many factors. It could be, one of the factors could be that some of the babies were given the immunities that had passed on through the placenta, and it would kind of hide the infection to some degree, so far as microbiologists being able to find it. And sometimes these babies, again, the sample size is too small, and there's very many factors why these blood cultures are often negative. But I have to question, there's other cultures you can do, placental and urine cultures, and even, if they would take on some of these babies, it probably would have been appropriate for them to do spinal taps. It's a way to check for meningitis, and you can just see, you wouldn't even need a culture. Well, you would send it for culture, but literally you could see as the spinal fluid's being dripped out. It should be the most beautiful crystal clear diamond. It is just gorgeous when you see perfect spinal fluid, but any cloudiness, anything that you could visually see, you just definitely could diagnose that there is some sort of a pathogen going on there and start on that. I gather from your presentation that strep pyrogen, I had mentioned a baby that had group A strep. And I will discuss all these unindicted babies later at another time. But strep pyrogen is mentioned from one of the non-indictment babies. This points to, but does not prove, poor hygiene at delivery or shortly thereafter. I had hypothesized that maybe it was on the hands of, again, the consultants who just seem to want to spend vast majority of their time in the pediatric wards versus the neonatal wards, and they always do their rounds prior in the pediatric ward before they go in the neonatal unit, which to me sounds like they're just it's more of an afterthought. Now, it's the classic bug of puerperal or childbed fever, and historically was a great killer, coming from the environment, not the mother's vaginal flora. That would be group B strep or an E. coli. But it was from the vaginal flora that Semmelweis would not have observed fewer maternal and infant deaths among the midwife-managed deliveries than among those managed by non-hand-washing documents. And again, Ignaz Semmelweis was an Austrian physician who is just one of these forefathers of infectious control. Unfortunately, he had suffered quite a bit. He tried to get the trainees and the doctors who were doing autopsies on people that died from sepsis, and then not washing their hands and then going and delivering babies. Well, these women were dying horribly from puerperal or child bed fever. I am going to link his story in my description. Hopefully it will take. And please watch it. It's only a 3-minute video, and just see how basically the doctors didn't wash their hands, and they had literally driven this poor man. He lost his position. He lost almost everything, and it actually drove him to eventually become insane, because he knew what he knew was correct. And everyone was just saying, well, what do you know? We are far greater than you. The poor man died in a mental institution at age 47. Now, there's question whether or not he died from infection, but we do know what happened and what caused it. He died like only a couple of days after being admitted to a mental institution. The guards beat him mercilessly, and there's question whether that he had died from that, and probably died from, he had some sort of an injury to his arm that we believe got infected. So again, it's just his story, again, parallels Lucy's in so many ways. So again, just want to show you something. Yep. The Empress always stands guard. You take care. Soon I will be discussing baby D, which is, again, the only term baby, and the one that was the one that, if any of them could have survived, it could and would have been this baby. And it just highlights the infectious disease, their lack thereof, infectious disease oversight. So take care. And again, anyone has any concerns, or not concerns, or just wants to give any input, I love being self-Dadix, and I will always try to give you any updates or any insights that someone will send me, and I appreciate all input. Take care. Bye-bye.